The war has impacted all sectors in Yemen, including the health sector. Currently, only 50% of health facilities are fully functional, and over 80% of the population faces significant challenges in reaching food, drinking water, and access to healthcare services. This report has more on this.
Just 50% of Yemen's health institutions were completely operational as of April 2021, according to a World Bank policy brief on health, nutrition, and population operations in Yemen. Moreover, more than 80% of the population had significant difficulties in getting food, drinking water, and medical care. This is all happening as a result of the prolonged conflict, economic decline, and institutional collapse. In addition, health-related disasters in Yemen have put an additional load on the system's constrained resources because they have outpaced its already insufficient resources in this area. According to the World Bank report for 2022, nearly 4 million people have been forced to evacuate their homes, 3.25 million are suffering from acute malnutrition, 5 million are at risk of famine, and 16.2 million are experiencing food insecurity. This is in addition to inefficient private and public health organizations, such as hospitals and clinics, that mainly depend on development partners achieving vertical health programs. Yemen's healthcare system is extremely reliant on external funding, and primary care is primarily provided by implementing NGOs, both local and international. Furthermore, the healthcare industry is facing a brain drain of workers, specifically doctors, nurses, and university professors. This is as a result of their living and working situations getting worse, or in some extreme cases, because they're being persecuted for their political, regional, or even religious ties, which can sometimes be lethal. The national health and educational institutions' ability to address the issues of this scarcity has been significantly impacted by the mass migration of healthcare professionals, particularly during periods of rising demand for health services.